Welcome back, everybody. We have Kyle and Luke here with us from the Texas Tech University Health Sciences Center School of Medicine, and we are talking about match day. So we were kind of talking about it off camera, but go ahead and I'll start with you. Go ahead and tell us a little bit about match day and why it's such a big day for med school students.
Yeah. So match day is kind of the day that all of our work throughout medical school comes together. We fill out our applications. We send out these applications to residencies all across the country. And all together on one day, this Friday, medical students all across the country, we open up little envelopes that tell us, where we get to go. So it's a pretty nerve-wracking process, but also very exciting.
Yeah, big step towards your medical career.
Yeah, definitely.
Okay, I'm gonna bounce over here to you now.
Okay.
What's the residency process like?
So it's actually a pretty long process to apply. We start kind of in summer, the preceding summer, and we put together an application, getting letters of recommendation, building a CV, things like that. And then you submit it in September, and then that begins a months-long interview process where hopefully you get lots of interviews, get to do that, and then that's what leads up to this match day. And then for residency itself, it's generally 3 to 7 years, depending on whatever specialty you do, and that's where we do our specialized training in whatever fields we're going into.
Awesome. Okay, now I asked y'all both this off camera, but I want to hear from you both on cameras. Let the public hear it. What inspired both of y'all to pursue medicine?
Yeah, I was actually a dancer in high school and in college, and I didn't know exactly what I wanted to do, but my love of the artistry of the human body really transitioned into a fascination with the science of the human body. And I knew I wanted to help people, and I really enjoyed learning, and so it really translated well into a career in medicine. And so I kind of decided a little bit later than most, but I finally decided that I wanted to be a doctor.
Hey, better late than never, man. It's all good. What about you?
For me, I just have always loved science. Growing up, everything about science fascinated me. And I think medicine's a really special way to kind of do science in a personal way. One thing that's great about medicine, it's a heavy burden, is that we get to spend time with patients in some of the most vulnerable moments. Days that might be the hardest day of their life, scary moments, we get to sit in those moments with them. And so I think that combined with just the ability to do lifelong learning, get to help people, just seemed like a no-brainer for me.
Okay. Now, for a lot of people out in the general public, when they hear med school, they're like, "Ooh, that's a lot of education. That's a lot of school." What's some things about med school that maybe most people don't think about?
I think probably what people think of a lot is what they're used to at school. It's like sitting down in a classroom and like hearing lots of lectures. And I think people would be surprised that we basically do all of that in the first 2 years.
Wow.
So the last 2 years are all spent like in the hospital and in clinics, rotating through different specialties. And so, by the time we graduate, we've had a lot of hours working in hospitals, working with different doctors, trying to figure out exactly what we want to do. We get a lot of exposure before we have to make that decision. And I think it really helps give us a well-rounded view of not just what we will do, but what kind of everyone does in the field.
Absolutely. Now, have y'all decided which field of medicine y'all kind of want to focus on, or are you still kind of thinking about it?
No, we've definitely had to decide at this point.
What about you?
I want to do a combined program of pediatrics and psychiatry. So there's not a lot of them, but it's kind of everything I want.
Okay, a little fusion approach, I should say. Awesome. What about you?
So I applied something called internal medicine, which is kind of a general, it's an internal medicine residency, which is kind of a general medicine track. And then so I'm actually still a little undecided because you can sometimes do afterwards something called a fellowship. So after 3 years of residency, you can apply to subspecialize further into things like cardiology, gastroenterology, pulmonary critical care, just to name a few.
Absolutely. Now, we asked y'all this off camera, but we got about a minute. Where are y'all hoping that you end up going?
Yeah, I'm actually from Utah originally, and so we applied all across the country. So we really like Cincinnati, has a good children's hospital there, and one of 11 of those combined programs is in Cincinnati as well.
Okay.
And for me personally, my wife's family's from Dallas, so we've got a few programs in Dallas that would be great. Also applied all over Texas, so not quite as broad as the whole United States, but yeah, hoping to stay somewhat local.
Okay, man, we wish y'all the best in y'all's careers, man. This is an awesome deal. Now, we got about 30 seconds. How can people connect with the Texas Tech University Health Sciences Center School of Medicine?
I know we have social media platforms, and we have a giant building off culture. Y'all are always welcome to come in. I'm sure that people would be happy to kind of show you around and tell us more.
Okay. And quick tip for anybody looking to go through med school.
Just hang in there. You'll do great. It's a grind, but it's worth it.
Absolutely. All right.